Let's get some more reaction to the briefing. We can talk to Niall Dickson, who is chair of the NHS Confederation. It's a membership body for organisations that commission and provide NHS services. Niall Dickson, it sounds like we're going to get something is going to be said about care homes tomorrow. I just wonder whether you can, rather than react to what we've just heard, is preview what you think might be something Matt Hancock can say.
Well, I think the lack of recognition of social care, which I have to say is something we've been going on about for some time, it really needs to be addressed. So I think I know the Health Secretary has mentioned it before, but I think starting to put care homes more front and centre, it is inevitable that people talk a lot about the NHS. And of course, our members on the front line, both in hospitals but also across the communities, are facing really difficult situations. But that's no different from what people in care homes are facing, some of whom, frankly, are paid very little. And we have not concentrated enough either in terms of making sure they have the right protective equipment or indeed that they have the right funding and so forth to deliver care. And I think people in the whole social care sector have felt very neglected during this period, as indeed some, for example, in mental health, as well as we've concentrated inevitably perhaps on those who are very ill in the main hospital sector. So it's not saying one is better than the other, but the first thing I'd expect tomorrow is an absolute recognition that there's another area of virus which is being fought very hard, where there are an awful lot of deaths and an awful lot of tragedies going on, and we need to make sure that whatever efforts we're putting into the hospital sector, which has done an amazing job at flexing itself and changing itself to deal with this, but we also need to provide equal amounts of effort in terms of testing staff, in terms of the right protective equipment, and in terms of the funding and support that they get.
Are you happy with the way the government has communicated on the PPE issue in particular? I mean, I'm struck that I don't think I've ever heard them say we don't have enough, and we're sorry for that, and we regret not, if you like, building up a strategic reserve ahead of this crisis to make sure we have the wherewithal to withstand it. But we just get sort of inundated with figures of we delivered another 40 million pieces or items to hospitals today. Just interested in your sort of take on the way this has been put to us.
Okay, so I think we're always slightly reluctant to engage in a kind of blame game because we want people to concentrate looking forward and there'll be a big inquiry. But I take your point, so it's a reasonable one. I think what has happened was we did have very big stockpiles, additional stockpiles because of the Brexit no deal. I think the problem was we did not have a distribution system, particularly at reaching those those small customers, as it were. So the NHS supply chain, which had 230 customers on one day, suddenly found it at 34,000 the next. And in terms of communication, I think it is probably always better to say, yes, it wasn't that we were short of stuff, we just couldn't get the stuff out. And then some of the stuff when it first went, I think the guidance wasn't clear enough, and that has been sorted since then. The guidance now has the backing and support of the Royal Colleges and the World Health Organization. So some of these problems have been fixed. But what you're right in saying is I think there's still a level of fear on the ground, and there is that also fear. Somebody was telling me this morning, they had a delivery yesterday and they expected 800 pieces of stuff and they got 400 pieces of stuff. That will last them for another 24 hours, but they need the next delivery. Another hospital talked about filters they were expecting, and they said, well, we will run out of those by 11 o'clock tomorrow. And of course they will get them, but they're very anxious, and
it's
this
all
increases
just in
anxiety.
time.
Very much in time.
And
that's why you get this fear on the ground, because people are putting their lives at risk, and so there's an awful lot, I think, there's still a bit of confusion and there's still a bit of fear. I don't want to exaggerate it. There are lots of places where it is working okay, but there are, and I think particularly in the community sector, there are shortages and people don't feel that they're getting enough or getting it on time, and they're having to sometimes buy from the private operators, as it were, not from the government stocks, and that's costing them more money.
Neil, I want to ask you one last question. Now, this is about the Nightingale in London, which opened and is reportedly has very, very few patients. We also are told we have lots of capacity in intensive care still, because we've built up a lot of capacity since this started. Yeah. And yet, the figures seem to suggest we are putting fewer people into intensive care than some other countries, with similar-sized countries with similar caseloads. And I just wonder what you think is going on here. Are we basically not putting into people into intensive care who in other countries would be given that?
I'm not aware of that. I mean, obviously, those are very much clinical decisions. I certainly don't think anybody is not being put into intensive care because somebody is trying to, I don't know, save money or do anything of that nefarious nature. I think the answer is people are making clinical judgments about when an individual needs intensive care or respiratory support of a sort of slightly lesser kind. You're right in saying that I think some hospitals are in a position where they're bracing themselves for the big surge, and they don't really know whether the big surge is going to come. A lot of places are already, particularly in London, under enormous pressure, but there are other places around the country, it's very varied, where they've geared themselves up, they are busier, they are doing very different things from what they were doing before, but they haven't yet seen that huge take-up of the extra capacity that they've got. And I don't believe that's because anybody is being too restrictive. These will be clinical judgments about whether an individual needs ICU or not.
Yeah. All right. Thank you so much. Niall Dickson, thanks for that. Yeah, you would assume if it's a clinical judgment, it would be taken openly if there is spare capacity there.